and the knowledge. That is where this conference is important, because then now it's with Dr. Paulo Angeli and a lot of, I see a lot of names which are mentioned here, which Dr. Balbir Singh has mentioned. It's a global meet on cystitis and hepatobiliary and pancreatic cancer. So this will significantly contribute as our government, for the government of Aam Aadmi Party or led by Bhagwant Mann and our national convener, health is the topmost priority for our government. And we are taking initiative to address it at the primary level, secondary level and the tertiary level. So that is where I am here to seek your support, how to strengthen for capacity building. How can your expertise and your knowledge can reach somebody in the Aam Aadmi clinic or Mahalla clinic in the village? How can we work together? We have various initiatives. Sir, first is the Eat Right initiative. If you eat right kind of food, if your food is organic and you take millets, more of vegetables, more of fruits, so you are likely to be more fit. Then we have introduced yoga in all the cities. So dietary, nutritional guidance, Eat Right initiative, and yoga. These are some of the interventions which we are making, and a playground in every school. So more of physical activity, because with this increased mechanization in Punjab, the life has become sedentary and our diet has become more of the processed food, and you see that is what is leading to non-alcoholic liver disease. So our government is trying to address it at the primary level, and then the secondary level is the early diagnosis and the treatment. That's where I found that there should have been many more doctors from Punjab, and I will possibly send them. DRMs have called them tomorrow. If they are not come voluntarily, I think they should have enthusiasm to learn, all the doctors. So we have already done it for cardiac and you see for stroke also. We have a hub and spoke model. That's what I propose for liver diseases, where PGI and our Punjab Institute of Liver and Biliary Sciences can be the hubs, and the entire of Punjab can be the spoke, all our district hospital and sub-division hospitals. So our STEMI project, that's the ST wave elevated myocardial infarction. So we provide that inactive phase injection even in primary health centers and community health centers, where the patient is thrombolized, then shifted to a tertiary care hospital for revascularization in time. Similarly for stroke, we have again provided, you see, the thrombolysis in the primary care and the secondary care. Then the patient is shifted to tertiary care hospital, which in this case is CMC, PGI, few private hospitals also. DMC has started mechanical thrombectomy. So similarly, I think we can work together for knowledge sharing and you see hub and spoke manner for liver disease also. I think we have to go right up to the village to educate people, and then you see early diagnosis, because if we are talking about ascites or hepatobiliary and pancreatic cancer, we are treating the disease at the terminal stage. We have a lot of CKD. So the reason was that hypertension or diabetes, they were either not diagnosed or not properly managed. So with the 881 Aam Aadmi clinics, so now their hypertension and diabetes are being diagnosed early. We are working on alternate, you see, therapy, in this, which I have already elaborated. So now these diseases are being managed. Otherwise, the disease burden is too much. We have so many dialysis centers. So with many NGOs, I have close to now 181 dialysis machines working day and night. But still, there is a lot of demand, and there was a study conducted by the AIMS, that most of the people, they slip below the poverty line because of out-of-pocket expenses on health. So we are trying to address that issue also. So I'm sure that your conference will show us the way. It will help us. This should be the beginning. And then we can send our doctors to Punjab Institute of Liver and Biliary Sciences, and Dr. Balbir Singh is already working on that, and we can send our doctors and paramedics also to institutes like PGI and AIMS, which we are doing for drugs. That's how we can progress. I wish success to your this conference, and I wish that you will have very useful deliberation, and then at the end of the conference, you will give us guidelines how to manage the liver disease, not only in Punjab, I would say northern India. We should lead by example. And last but not the least, in whole of India, I think it's a global problem, air pollution. It's not discussed in the parliament, it's not discussed in any of the assemblies, but I think it's killing us. This may partly be responsible. And food toxicity, again, it's not discussed. So any chemical that goes into body, I understand first it goes to the liver, what is called